Hi, everyone. Welcome for another week of DocTalk. And like we did last week, this week is going to be you talk. And you talked at the end of last week's conversation and gave me some really good ideas to think about for this week. And this week is your questions about why is all this stuff changing now? And it appears both national announcements and then what's happening locally is really changing how we're approaching COVID. And that is true. For those of you who have made that observation, we are really beginning to change things. So kind of good news, bad news week in terms of you talk. So here's what's occurring. We are moving from pandemic healthcare provision to endemic healthcare provision. The federal government is now deciding whether the public health emergency, which has been in place for 2 years, will end next month. And if it ends next month, we will be back to old rules, old ways of paying for our health care, old ways of delivering health care from 2019, if you can remember back that far. At the end, at some point of the public health emergency, we have to go back to conventional ways of managing our healthcare system and, frankly, of paying for it. So there's a very important second side to this. Most important for you, here's where we are with COVID. It is at very low levels that we haven't seen for a couple of years. In some areas, we dipped down this low in the middle of last summer. And you remember that was a pretty darn good time. We were thinking we had made it through and that we were going to be going back and doing things the way that we wanted to do them. And then this little variant called Delta came along and decided not only would it be very spreadable, but it would be very deadly. And in my hospital locally here, there's still 2 Delta patients in the ICU that they can't get off the machines. So Delta and then moving to Omicron, and Omicron was characterized by being very, very infectious, but not very fatal. That was a good thing. And many of us got sick with the Omicron variant. And at this point, between being vaccinated and having the illness, we have pretty good protection. And that's really what we're looking forward to as we move ahead. The numbers have gone down so dramatically that we've now been able to open up ICU beds, go back to our regular seasonal diseases, go back to our regular systems of replacing knees and doing heart work and doing cancer screening, et cetera. By the way, firefighters, cancer screening is a very important part of our health, both short-term and long-term, and really important for you to do. So we're back, and the hospitals are staying kind of busy because of that. Our COVID levels low means we're still trying to evolve how to do the right testing and treating, okay? And then the testing and treating is going to change. This week you heard the news that one of the infusion treatments, a monoclonal antibody treatment, became obsolete because the new variant isn't very responsive to treatment with that particular monoclonal antibody, which was called sotrovimab. So we still have one monoclonal antibody that's effective. It's available in relatively smaller amounts. We have our oral medicines, in particular the Pfizer product Paxlovid and the Merck product Molnupiravir, which work when given orally in reducing the level of infectiousness, reducing the seriousness of infection. So for those of you who are still going to get sick with the current variant of coronavirus, we still have oral treatments available, plus one of the monoclonal antibodies that's available. As we've gone through time, they're adapting the monoclonal antibodies so that hopefully for the next generations or variants that occur, we have monoclonal antibodies available. What though we have to do, we have to set up our testing and our treatments so that they're very effective for people, even though we're in smaller amounts of people getting sick. So the federal government announced a program this week called Test and Treat, big surprise, the Test and Treat program. And if you go to your local computer and type in Test and Treat, it will come up with what the federal government is now calling our Test and Treat Locator. And you can find out wherever you are in this country where the local test and treat sites are. In many cases, they're in pharmacies, some of them associated with our national chain pharmacies or retailers. You go there, you get swabbed, and they'll use one of the versions of the swab kits. And if you're positive, they can immediately provide treatment for you. And typically that's in the form of the oral medication or a referral to one of the infusion centers to get infusion medication. And that will depend on your symptoms and your underlying risk factors, and then a couple things about your underlying medical history that will kind of guide the treatment that they will prescribe for you. If you're very sick, as usual, you'll be going through the emergency department and a decision made about hospitalization or other things. I want to make everybody aware, although levels are low and acuity is generally low, that doesn't apply to everybody. And there are still people getting sick. There's still people who are going on ventilators and going in the hospital with the current variant. In some cases, even some of those are breakthrough infections for people who have been vaccinated, but for one reason or another, their vaccination was not effective for them. So good news, we have a reduction in the overall load of this terrible virus in our country. Some places in the world, it's still spinning around. We're keeping an eye on those. In this country, those overall reduction in numbers accompanied by our really good vaccination numbers and by our better ability to manage you if you do get sick with test and treat or with going into the hospitals that has open beds. That's good news. A second piece, many of you have figured out already, hey, written into this is something about that I have to pay for it, that you have to pay for it. Now, since we began this, most of the programs for both testing and vaccinating and treating have been free. In other words, your federal tax dollars have been paying for all of the program to test and treat. Moving into the future, we will go back to the conventional system where people will have to pay for their tests, and they will have to pay for their masks, and they will have to pay for treatment, either out of their pocket or through their medical insurance that they have. So that is us moving from pandemic to endemic, when the regular ways of paying for care begin to come back into notion. And if you have COVID, your regular health insurance and your out of pocket is going to pay for it. That's a big difference. For those of you who want to get vaccinated, now's the time to get that done while that is still available under federal dollars and is free to you. Otherwise, at some point, the vaccinations will also be a for-charge item. The good part of this is we get to think about some other things that go on, and we get to move into a situation where we say, okay, we got our summer stuff to prepare for, we got our winter stuff next year to prepare for. We're going to restore some of the stability in our healthcare system. We're going to restore some stability in our local budgets, getting people back to work, et cetera. For my fire and EMS services, we've been on unstable financial grounds simply because local revenues have kind of fallen to pieces through many of the lockdown times. So hopefully those kind of items stabilizing our economy gets us back moving forward. So DocTalk, UTalk this week, we wanted to know about how this is moving back into a regular system and why am I hearing some of these things about treatment and testing, and then even about it costing me some money out of my pocket. That's what happens when we move from pandemic to endemic, and overall that's good news for us. Please take care of yourself still, prevent infections where you can. For fire EMS providers who are going into places where COVID is still a risk, please use your appropriate PPE. Please do good things in terms of staying home when you're not healthy. Always a good idea. And number 3, keeping your family safe. You don't get sick means they don't get sick, and vice versa. If you haven't been vaccinated yet, please take the opportunity to go get your vaccines now. Still good news on the vaccine front in terms of us adding a couple more vaccines into the system, and then adding the under 5-year-olds for those of you who really are concerned about your kids, as you should be. So DocTalk, UTalk, another week. Here we are. beginning of April. It's a wonderful time in the country. Take advantage of it. Thank you.